I don't so the supplements I do take, I don't prepare them a week ahead of time. That's a really good idea, and I know a lot of people that do that, and that's super helpful. So
Yeah, I
then you
know.
just pop it open.
Right. Makes it
Yeah.
so much.
The only problem is that I use liquid supplements
Ah, okay.
as much as I can. And
Yeah.
so, you got to get out the droppers for each one. You could put them, and people do that. They take the droppers and they actually put them in capsules.
Really?
Yeah, but that seems like a lot of unnecessary work to me. I don't know. But yeah, that's
And other,
just one of those things that it needs to be like habit stacked. And
yeah.
that's part of the problem for me is if I don't have the routine already in place, then it's hard to stack the things on top of it. So I have to get the routine first. And yeah, I have bits and pieces, but they're not super consistent. Simple things like setting out your clothes for the next day. Or for me lately, I've been getting up first thing and just going straight to work. Because I have to get some highly important and prioritized things done. It's really hard to do them when all the chaos is happening.
Right.
So I've been trying to get up a little earlier and just go straight to work. So part of the things that can help with that with the nightly routine are putting out the clothes, getting my computer set up to where there's nothing on the screen except the one thing that needs to be done. So it's all about reducing cognitive load and distraction so that it's effortless to come in and just start.
Yeah.
So those are the things I can do. And then ideally, what that does is that would trigger the nightly routine. And then you just go through and you just kind of check things off the list, right?
Mhm.
But because things have been so wonky and changing so much lately, I don't have the list. Like I need to start the list over. I need a new list of the most important things, and I like physically need to have it like on my phone or written down so I actually go and check those things off. It's like this constant
Right.
iteration that we always keep having to go through, right? And I will admit I'm not the best example of this because when things start to go to hell, I get rid of it, and then I have to come back and start totally fresh and new, which is a little different than just adjusting things as you go. That would be the better, smarter way to do it.
I'm the
But
same.
I like to do things the hard way. So when that does happen though, and it happens to everybody,
Yeah.
when you fall off that wagon, then it can be really hard to jump right back in at the same level that you were at.
Mm. Yeah.
So in this scenario, what's up, Monica? Hey, Joe. Hey, Zoe and Karen. I like that you changed your name there. No, we're all here. Good to see you. We're talking about my nightly routine and how it's completely non-existent, pretty much. And with all the changes, with all the babies and just life and how it's completely made a big shift. That's the first thing for me that tends to get put to the side is my own health and personal development. And we all know, put your own mask on before you help others, right? You got to help yourself if you can if you're going to be able to help anybody. So yeah, it's in my head too. Yeah, I know. I coach on this stuff. I get it, right? But I'm my own worst enemy at times. And it comes down to black and white thinking. That's my main like self-sabotage kind of cognitive distortion that cops up. Kirsten was asking about supplements because nutrition is kind of a sticking point for me sometimes. And I'm like, yeah, if I'm not like watching my food, tracking my protein intake, and doing the basics, then I throw everything else out the window. Oh, you didn't get your protein in today? You might as well quit taking supplements forever. So it's kind of ridiculous when you say it out loud, but um, that's been my pattern for my life. So right now I'm struggling with the nightly routine, and what I was saying to Kirsten is like, I don't recommend you do this. Like when things start to change, that you just drop everything and focus on the thing, and then you have to start it all over again from scratch, basically, because that's kind of what I'm at right now. It's better to transition, keep those foundational habits, and adjust them as needed. But in the case that you do fall off the wagon, like I tend to do, then thinking that you can go right back into the same level of competition, if we're talking a sports analogy, right? You're not going to be able to get in there and like play with the big dogs right away. You got to regress. You got to regress and find your minimal effective dose. And so for me, I have a couple things, like oftentimes I'll set out my clothes, I'll get my computer set up with no distractions, just to make it really easy for me to transition from sleep straight into work, which is what I've been doing lately. Um, and then, you like your nightly hygiene. These are things that I am already doing. So now it's like, okay, can I can I make one of those like a triggering event, a cue that will then start the process? But for me, since I'm basically starting fresh, I have to have a list. I literally have to have something where I can check the boxes. And I use an app for this called Habitica, which is super fun because it's gamified and you can like build your character and go on quests. Um, so it's kind of fun. I like that aspect of it. And if you don't check in on your daily tasks and mark them off, then you get hit, right? And you lose health. So you level up. I mean, it's got the whole gamification thing mixed in, which is really helpful for me. Not for everybody, but anyway, that's what I use. But I have to go in there now and like restart every single one of those tasks that need to get done in order for me to then make this a habit again. The pathways are still there, so it won't take as long to get back in that groove, but you got to like struggle a bit and get into momentum, and that takes some regression. So, rant over.
Maybe you could use the brushing your teeth as the trigger, because that's probably something you will do anyway. And then you can add one more thing tonight and a second one tomorrow.
That's perfect. Exactly.
I will check on you Thursday.
Yeah. Thanks, coach. No, that's exactly right. That's exactly what I need to do. I will report back when I
Okay.
do. Okay. Yeah. How's everybody else doing? Welcome. Did you bring your coffee or your dinner, as in Kirsten, since it's 6 p.m. in Germany right now. Is it 6 p.m.?
It's 7 p.m.
7. Oh, yeah. We're on Pacific time now. Cool. Well, yeah. Thanks for being here. What's up, Monica? How are you doing?
I want to share something really awesome.
You can share. Go ahead.
Yeah, because a few weeks ago when we did the 30-day challenge, I was writing that my smell improved very suddenly. I worked on it for a few weeks, I don't know how long, and then suddenly it improved, and I was smelling the stinking cars and things like that. Now I was in my friend's garden, and the magnolia tree was blossoming, and I smelled something really strong. I was asking my friend, what is this? It's smelling so nicely. And she said, I don't know, magnolia trees don't smell much. And I was saying, but there is something really strong around here. It was everywhere. I was smelling it not only near the tree, but further away as well. And it was the tree. And it
Hmm.
was, I don't even find the words in English, but it was really awesome. Like I didn't have an experience like that in a long time. So maybe my smell was impaired for a longer time. But it was really, really nice to be able to smell. And now I also know it this the change in my smell, in my smelling ability wasn't just for 2 days. It's still there. And I don't do this drill anymore. So it's permanent apparently, which is great.
Good.
Yeah.
Yeah, that's wonderful. The joys of smelling good stuff. Yeah, you don't realize how much you miss it until it's gone, right?
And
Or how much you use it and how much you depend on it even.
mhm.
So that's really cool. That's really cool. Thanks for sharing. What else is going on out in there in the world? Zoe and Karen raised a hand. What's up, Zoe and Karen?
Can I talk? This is Karen. I wanted to say, I was just curious, is she smelling better because she's doing the vision drills? Or is that a byproduct of the vision? Or is that, I was just curious if it was how it's correlated.
What have you been doing, Kirsten?
It has nothing to do with the vision drill challenge. It was the challenge before that, where we chose any drill and just did it 5 times a day. And didn't even do only the smelling drill, but different ones. But I focused on the smelling. And what I did was I had a smelling oil that I sniffed on and tapped on my one side of the nose while I was sniffing the oil, and then the other side. That's all I did concerning the smelling.
Interesting.
Yeah.
That's great. So the tapping is to kind of just tell the olfactory nerve that's responsible for processing smell to wake up a little bit. Some other things you can do to improve your smell if you lose it for whatever reason, like after a virus like COVID or something, it's pretty common, is number one, that smell and drill, all sorts of different smells. And it's kind of just kind of a mindfulness process where you're kind of telling your brain like, I want you to smell this more and pick out what it is and just kind of going through that. But because of where smell is processed in the brain, which is in your temporal lobe, there are other things that you can do, like listen to music and do vestibular drills. Uh, I would, I'm actually making a connection I haven't thought about before, but I think vagus nerve drills would also help because of their association to the vestibular system in the insula. Um, but the other things I was just thinking of, and then I'll go to Joe. He's probably got some more ideas. Um, well, now I forgot them. Joe, what do you got?
Well, the way the way that you just brought that up, kind of connecting some of those different things, it made me at a chiropractic event, they were talking about how to fix smell for COVID. And a functional chiropractor had discovered that you need a partner to help you do it. But if you pull and hold your tongue and your partner flicks you below your occipital lobe back there in the back of the head, usually like one or two, 3 times, and then the person, he discovered that people's smell turns back on.
Wow.
I want to know the process of how he discovered that. Like,
I don't remember. He
how many
told
places
it.
did you have to flick?
I walked into the conversation at a different time as to like what his reasoning was. I completely missed his reasoning behind it. But he was just talking about it, and I was like, what?
Well, that's where your brainstem is right at the base of the occipital is where your cerebellum sits inside the skull and the brainstem kind of starts to protrude out. So that's right at the brainstem.
So that'd be real similar to the tapping on the nose, just tying the tapping back there potentially.
Yep. And then the tongue Obviously, you're
Yeah,
activating cranial nerve number 12.
Pull,
Number
pull.
12, and the other ones that innervate for the sensory input to the tongue, like cranial nerve 7. Sorry, not 7. Well, 7, part of 7, and 9. And so those are a long ways away from cranial nerve number 1, right? But there are what are pathways that connect them, otherwise known as reticular formations, they're sometimes called. And so there is connections going all the way down. And if you think about it, it makes sense. Like when you smell something disgusting and your brain is like, oh, that's terrible, right? Like smelling vomit. Anybody smell vomit and want to vomit? I do. Yeah, makes me immediately start to gag. So that gag, that all comes from your vagus nerve, right? That's the motor output of your vagus nerve is nausea and actually throwing up. So there's obviously a quick connection there between smell and vagus nerve, right? Which is way lower in the brainstem. So point is, there's a connection between all those. So when you work with some other cranial nerves, you can also help that olfactory turn back on. And also, what I was going to say relative to Karen's initial question about vision training. No, Kirsten was not doing like the smelling with her vision training, right? And it kind of started to get better before that. However, the optic nerve sits right next to the olfactory nerve. They are siblings. Yeah, number 1 and number 2. So any work we do with our vision is going to naturally spill over a little bit with some activation in surrounding areas. So you might get a little bit more activation of the olfactory nerve just by doing different vision drills. So in an indirect way, it can actually help with improving smell. But the way that Kirsten did it is the way that you want to actually start to retrain and differentiate. You guys know what a sommelier is? Like a wine expert?
Oh.
Yeah. Or just wino for the layman's term. Well, I have a close friend. He was played football with him, and he was a roommate after college for a while. And when we were living together, he was studying for his sommelier, and he was not a wino at all. In college or anything, we never drank wine. It was like beer than liquor because you got there quicker, that kind of thing. But the after college, he started working for a distributor, really got into wine, and we would taste wine all the time. He would bring home new bottles of crazy cool stuff like a Gewürztraminer, right? Which was my favorite white wine, Gewürztraminer. It's like a not quite sweet like a Chardonnay, but a little more dry, but not quite a Pinot Grigio or, I don't know anything. I don't drink. I haven't drank for 10 years. But the point I'm making is that he got so developed in his palate that he could pick out the wildest notes in the wine. And just throughout our life together, he could smell anything, good and bad, right? It was that skill he developed very finely, and it's even gotten better and better as he's gone on. So it's 100% a skill that can be trained, just like everything, just like our vision can be trained, our balance. It's all the same kind of process. It's stimulus, um, adaptation, repeat, right? Um, so the smelling with the tapping, trying that, that's a great idea. If you have a laser or a red light, you could use that on your brainstem also while you do smelling drills. You can listen to music, you can do vestibular drills, you can do vagus nerve drills. All those can support the process. Go ahead, Kirsten.
Does the activating the brainstem with flicking or with red light, Does it also help with other kind of drills?
Yeah. Yeah, your brainstem is where all of your autonomic function sits and all your cranial nerves. So basically, anything you're doing with the head and neck is going to involve cranial nerves. So any vision drills, any vestibular drills, any breathing drills even, they're all regulated by the brainstem. And they all have nuclei that go into the brainstem. And so better activation and better balance in your brainstem is going to go a long way for a lot of things.
I'll try that.
Yeah, so what I would do, Kirsten, if you want to just see, number one, you have two sides, right? And there's usually one side of the brainstem that's a little bit lower in activation than the other. If you remember the PMRF conversation, if we've ever had that in here.
Yeah, we have.
Okay, that's usually the one that's deficient. And then sometimes your midbrain or mesencephalon, which sits at the top of the brainstem, that's kind of the one that does the seesaw, the push-pull with the PMRF. You can think of the PMRF as kind of the parasympathetic, down-regulating area of the brainstem. The midbrain is more of the up-regulating. Let's get up and let's go. Do I need a sympathetic response? That's what the midbrain is always asking. The PMRF is asking, do I need to chill out? Okay. Very general terms here, but if you want to, it's hard to put a laser on the midbrain because it's being blocked actually by the cerebellum. But you can do it on like the PMRF and the cerebellum by just using like a red laser or just try tapping. So I'm just right below the occipital ridge, just tapping on that side a few times and then just reassess. It can be that simple. Then you can tap on the other side, reassess that. And my brain clearly was like, left side, no, no, thank you. Right side, okay, cool. Have we ever talked about the high-speed tissue assessment? Okay. It's you can do it for anything, but we often teach it in terms of scar retraining or scar rehab. All right, so the simple version is if you have a scar that's accessible, you can test it on a scar because those are usually more neurologically active than just regular skin. So I don't know if you can see it, but do you see this scar right here? Just a tiny little scar. You guys see that? Yeah.
Yeah.
I don't even know where I got it. Don't remember. It's been there since I was a little kid. Okay. Now let me see if I can do this in a way that it's really hard unless I just do my neck. Okay. Pretty stiff going to the right. Can you guys see that? Yeah. Okay. All I'm going to do is just put some pressure, just the lightest amount of baroreception. Tiny little bit of pressure, barely even pressing down. Okay. I'll go to the left, a little more there.
It's better. Yeah.
By about 30 degrees.
What's he press?
Take it off. And my chin is a couple inches from my shoulder. Let's see if I can find it again.
So if you put a bean on there, have you put tape that?
Incredible amount of change. All I'm doing is just barely pressing on this tiny little scar. Joe, I have tried to just put like a little, it's not an M&M. I don't know why an M&M came to mind, but it was like a little jelly bean or something that wasn't gonna melt and taped it. But it stayed on for like 5 minutes because I moved my hands too much and it fell off. I haven't found a good way to tape it. So it remains neurologically active because I haven't been able to reform that scar so that my nervous system integrates it into its sensory map and it doesn't cause threat. Okay, so that's high-speed tissue assessment. All I did was press down. The next step would be to move it in all these directions, just the dermal layer, see if there's any barriers, and then test those, and then maybe go a little levels deeper and test those areas. And then, like Joe said, if I find one that really opens things up, I can pull it and tape it in that position. So I'm just getting passive nervous system input that's lowering threat. And as I move through the world and actually use my hands and even just walk through the world, it will reform. Remember, form follows function. So the fascia, the tissues, all of that scar will remodel itself on these new lines of force that I create with the tape. So that's how we can rehabilitate those areas. But that was not the point of the discussion. The high-speed tissue assessment was. So you can do this on any area of your body, by the way. I can do it on an area that has no scars, no nothing. It's likely I'm not going to get much of a change. But what you can do is around joints, like for instance, like in the brainstem here, or let's use your ankle. I can go to somebody's ankle and I can just, kind of put my fingers on that ankle at where the joints are, right? There's a lot of joints in there, but let's say, the lateral ankle tilt, okay? It's the talocalcaneal joint for all my anatomy nerds out there, okay? Small little joint, right? I can just, before I even do an assessment with the ankle tilt, I can just put my finger on that joint and just ask them to reassess right there. If that goes better, that's their nervous system telling me, I like that. I like that little information you're giving me right here. Let's do some more here. So before I do any joint mobility with anybody, I can do this high-speed tissue assessment to kind of check in, like, where do you want me to work? Where should we start? I mean, it's not necessary, but you can. You can definitely do that. And that can be really helpful for somebody that's had an injury, by the way. They're oftentimes not going to want you to work on the injured area, which is why we have opposing joints and nerve mechanics drills and vestibular and visual drills and breathing drills to help reduce pain and even get rid of some inflammation. But you can check with the high-speed tissue assessment on that injured area and just be like, yeah, how you doing? You ready? You ready to move this yet? Like, can we work here? So it can be useful. It can be useful in lots of different ways. But on the brainstem, that's basically what you're doing here. You're just kind of like, hey, 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 what's up? You want me to work here? Should we do something here? Let's try it out. Now everybody's tapping their skulls. I love it. Sandra, how you doing? You came in at the perfect time. We're skull tapping.
Skull tapping. All right. Sounds like a band.
Zoe, did your hand go up? What's up?
Yes, as part of the vision training, I have said for years that I don't see people's faces or I don't recognize them.
Like you have face blindness?
Huh? Yes. That's a thing.
I don't know, actually. I think it is, but
Yeah.
I could have been getting scammed. Is
No,
it really?
I've heard the thing.
It is? Okay. All
I don't
right.
know more than that, but just validating it's a thing.
It's a thing. It's a thing. So, Zoe, when you act before, I'm assuming it's kind of changing. That's where you were going?
Yes, well, that's what I'm working for. And I think it's changing a little.
Wonderful. So when you When you see someone's face, do you just have a hard time remembering faces, or is it actually kind of like blurry when you look at their
It's
face?
two things. It's both of those.
Okay, interesting.
And 'cause in the grocery store, like I mentioned to you before, sometimes everything is blurry in the store. So now when I go in, I'm working to do, you know, something to wake that up, and that is helping.
That's
And
wonderful.
and so now, instead of not even trying to see the person, I do at least look.
That's
And
good. Good.
and I am seeing faces better. I haven't got to the recognition piece because I think it's two different things.
Yes, I
Mm.
would venture to say that you are correct.
Mhm.
But that's great. That's great. Your drills are going good.
Mhm.
Good.
And also, Karen, you want to tell them about at our meeting?
Yeah, I'm noticing that I'm able to see words on a screen that I haven't been able to see in I can't remember how many years, you know, because wherever I would sit in the room, I wouldn't even look up at the screen really. I mean, I would look on my device to
Mm,
be clear as to what's going on and to follow and coordinate. But now I'm starting to recognize words and letters, and I'm like, wow, oh. So that's great.
that's wonderful. Yeah, very nice. Glad to hear it.
I'm
Well,
thankful.
yeah, well done, Zoe and Karen. Keep it up.
Zoe, I have a question.
Yes.
The recognizing of the not recognizing faces, have you always been having that, or has it started sometime in your life?
I would say maybe the last 10 to 15 years, that's been my conversation with myself. So I don't even try to see people anymore. But I'm working on that, just stopping and looking to see if I can see the face.
Okay.
How about when you're online?
Like now, of course, I can see you all. However, if there was chat up here, I would have to get right dead on the screen to see the chat.
Mm,
But the faces, of course, because I know you all so well, I in my, I know what room I'm in and all of that.
good. Keep it up. That's
Mhm.
great progress. That's great progress. I expect it only to get better from here.
I'm excited about it.
Good.
I know that for autistic people, it's often a trait that they can't recognize people's faces well. And that's why I was, has it always been like this for you, or is it something new? And I wonder if it can improve for autistic people as well.
Yeah, that's a good question. And only because I'm going to be conscious of it, I'm sure that it will improve because I think all of us have quote unquote autistic traits. You know what I'm saying? So
Yeah.
It's a spectrum. Yeah,
it's a
but
spectrum. Yes.
yeah, some certainly more than others.
Right.
Let's see. Um, Joe, remind me what's the term that we have for
Neurodivergent.
autism now? No,
Neurodivergent.
neurodivergent is a popular term, but we don't like that term. We have a better one. Do you remember? It's from live training one time.
Don't remember.
You weren't in that one, Katie Whittier?
Nope.
It came out of the idea that um, neurodivergence or a neuroatypical or autism, whatever labels they put on it now, tend to carry with them a negative connotation. And we don't like that
No.
because there's really not, it's just, I don't think there's anything really super negative. I mean, in extreme cases, there can be, and they have challenges for sure. We're not minimizing any of that.
Mm.
But what actually happens in the brain is that during our first years of life, most of what the brain is doing is pruning away connections, not adding connections, right? We're born with like all of the connections possible, essentially. And our brain just starts chopping things off that are unnecessary. But in a autistic brain, that doesn't happen as much. So they end up with way more connections than a regular brain, um, which can be in some ways like a straight up superpower.
Mhm.
You end up with a lot more empathy, oftentimes, and with like sometimes like incredible amounts of awareness, sensory awareness, and interoceptive ability, and um, can even develop into some pretty wild skills. But the cost is a lot of times like a sensory overwhelm. And that's really hard to mitigate and work through to get to the gold that's underneath. That seems like to me one of the biggest issues in neuroatypical presentations. So
And
I'll think of the term. I'll have to ask Matt or Katie because we had a really good term that came out of it that was like way more uplifting and empowering. It's like you're like neuro superhero.
But I think
But
that
in my
go ahead.
in my experience, the people in the autism world with like doing all of Dr. Amon's brain health coaching program, the 7 types of ADD versus ADHD, and getting into all the types of scans and what takes place is it's just a lot of brain inflammation. And if you calm the brain inflammation, then the superpowers emerge.
Sure. Yeah, I mean, that's another problem that can arise. And it's usually how it starts. And this is not, I'm not saying I have a bunch of research to back this up, but just the way that my mind thinks about it, and from the research that I have done, especially around, development for infants, is that a lot of it starts with brain inflammation.
Mm.
And whatever the trigger is that kind of opens up the blood-brain barrier and allows for inflammation to get in there, regardless of what the trigger is, that seems to be kind of the problem. And so there are nutritional strategies and detox strategies to help tighten those junctions back up and also clear inflammation out, which can be done throughout life, right? There's no perfect time. I mean, when you're a baby is probably the perfect time, but what's the saying? Like the best the best day to start was yesterday, but today is a close number two, right?
Mhm.
Um, that and then just dealing with the excessive sensory input with tools like inhibition tools or whatever else, you know, you need to do. Those two approaches I think were at least top of mind for me.
Yeah, but most of this information people don't have access to, so they start
Right.
labeling and restricting, especially children,
Yeah.
and it stunts their growth. I've had the privilege of working with cerebral palsy children and many autistic at every many spectrums, and they are some of the most amazing humans I've ever spent time with. So this information would help, and so I'm glad that
Okay.
you are all about getting it out to the professionals in the arena.
Yeah. Have you all ever heard of something called the telepathy tapes? They have a podcast. I forget the woman's name right now, but if you just search telepathy tapes, you'll find the podcast, and they're making a documentary now as well. Um, but it's just her stories of these kids that have, and I forget the name of the condition, but they essentially have a disconnect between their mind and body. They can't control their body. And so they're usually non-speaking. and they don't really have a good way to communicate. And so they use telepathy. And the podcast is basically just story after story after story of them proving that this is happening. And it just goes to show that, well, number one for me is that we all have this skill. I think it's a latent skill that we stopped using, and so it atrophied. It's use it or lose it, just like everything in the brain, right? I believe that we all have this skill in there that can be fostered. And then also, like the most important thing I think that could come out of something like this is just if we can change the way that we deal with these kids. Right? Don't just shuffle them off into a dark room and forget about them, which is what happens most of the time in schools, right? Like let's actually, foster these gifts. Because man, it's like on the one hand, it's incredible stories and it's so cool that this information is getting out there, but I couldn't help feeling so sad for all of the people. I was thinking back to my school days and all those kids that got just wheeled around.
Yeah.
Because I don't know about you guys, but I would always make a point to like acknowledge them and say a few words because I knew they were in there. Their bodies just weren't working, weren't cooperating. But you could tell, when you locked eyes with those kids that they're in there, they just yeah, and it just seems sad and so lonely to me. So
Yeah, but when they get their transformation, it's so effing cool.
yeah, 100%.
Yeah. I wanted to just share that I think my experience with people like that, in particular with my sister, I've noticed that when they come in contact with her, they have a whole different perspective because I can tell that they communicate with her. They get it that she cares about them, and they always have. And we also have an experience with the guy that works on our car. He has what's considered an autistic child, and the parents, what they do is they always communicate for the kids. They say, well, he can't hug, or he can't talk, or he can't this, and I hate that. And so they label their own children, and so but we always just talk to the child, acknowledge them, and ask them questions and what have you. And that child is communicating with us. Mm-hmm. Last time we went there, and we'll take them snacks, and that child, the last 2 times, has communicated very well with us. And he even he started jumping, and we're like, wow, you really can jump. That's great. But I mean, it's like someone notices me and they know that I'm real and I'm alive and
I'm here.
So, and I say this too, because I took care of my mom had Alzheimer's, Zoe and I, for over 10 years. And people label them. They say, oh, they don't know who you are. Well, it's a communication thing. They know who you are. It's just that you don't think they know who. So it's interesting, what we're talking about. I love it.
Yeah. Thanks for sharing.
But the labeling is one thing, like labeling somebody else and then having negative thoughts about it. But for me, I was diagnosed autistic last year. So I've been autistic all my life, but not the kind that wouldn't speak as a child. But I did have all the signs as a child as well. Showing different in girls is usually showing very differently than in boys. And for me, it was a huge relief to be diagnosed last year, because now I got to know other autistic adults and connect with them on a whole different level. When I went to this self-help group for the first time, after half an hour I had to cry because I felt understood. Just the way they behaved, the way they talked, the way they let me have space, enough space.
Mhm.
Neurotypical people don't do that. They get too close to me. It's always getting too close in different ways. For me, it was really, really helpful. And now I just started a therapy group for autistic adults. And it was today for the second time. And it's the same thing again. I feel so understood, and so much more than by the psychologist, right? He knows all about autism and does the right things and says the right things, but still I don't feel understood by him. But by the others, I do.
Nice.
So good. Yeah.
It's wonderful.
Yeah.
Yeah. That's awesome.
And also understanding myself better, right? I'm thinking like, oh, okay, this is the trait I only have. The others don't have that. And now I'm trying to learn how to navigate through life with these traits. Before I was just thinking, I'm different. I'm awkward. I don't know. And now I'm like, oh, I'm just autistic.
I really appreciate you sharing that, because we had an experience in the last few weeks with someone that I think is very similar to what you just described yourself. And it's like we all communicate differently, and everybody doesn't want someone touching them and hugging them. Doesn't mean anything's wrong with anybody. And just to understand, we have to figure out how to navigate so everyone can feel safe. So
Yeah.
I appreciate you sharing that.
Yeah, and this world often does not work the way that I feel safe.
Yeah.
At least now I know what I need better. So make my world safer.
Yeah. Yeah, and that's the key. That's the key. Is figuring out, and because even, you know, labels can be helpful, can be hurtful, right? It depends on the context. Like for you, Kirsten, I can imagine that was a huge relief to know. I have a client who's been to every specialist you can imagine to figure out what this pain is in her head. And everyone, in the highest ivory towers in Western medicine, have told her there's nothing wrong with you. We've done every scan possible. Your brain is fine. Your spine is fine. Everything's fine. You're fine. It's in your head that they come to next. And she's in that spot right now. She's so frustrated and annoyed and feeling just like, you know, just shooed off to the side. Like you're not important. There's nothing wrong with you. It's in your head. Like, how demoralizing is that from people you trust, you know, to help you? So yeah, I definitely get that. Because she just wants to know what is wrong with me, right? And like in your case and many other, I'm sure, undiagnosed people out there that have these traits that land somewhere on the spectrum, right? Feel different, and they're like, is there something wrong with me? Why am I different? Why can't I just like be normal like them in this situation? So that makes perfect sense. The trouble with labels is that when we use them as like the be all end all and use it as kind of like an excuse to just, you know, I don't know, stop trying, or to categorize people and just put them in buckets. Because the danger is that it takes away from the individuality. Like your, Kirsten, form of autism is vastly different than Joe Schmo down the street or plain Jane over here, right? They can have totally different presentations and traits, and they may act differently in a situation that you may be fine in, and vice versa. So that can be a danger, because when we start just like putting everybody in the same bucket of like, okay, autism, you go to this classroom now, and they all get treated the same way, the same curriculum, the same environment, right?
You're not
That can be trouble.
Mhm.
So that's the only caution I would throw out there with labels like that. But yeah, again, I'm sure that was a good feeling to know, okay, there's this thing. This explains a lot of what I'm going through. Now here are the things I can do about it. Right? That's the most important part. It's like what's the next step? What can we do?
But actually in Germany, they don't have anything to do. So the only thing they do is usually is giving medication.
Mm.
Mm.
Not really a good option.
Yeah.
And for me, it's only a good thing because before I knew that, I started doing brain work, neurodrills. And so I know I can change things for myself. And I'm trying to learn to navigate my nervous system, right? The others don't do that. They have never heard about it, and nobody in Germany has. So all the people in my group are taking medication or starting it soon. And I'm like, what? But it's the only treatment they have. Plus this therapy group where they learn things about autism and how can we behave with ourselves in a better way, which is fine, but it's not really changing things. And for me, the neurodrills are really changing things. So yeah, I still don't know. Maybe one day I can help bringing these ideas to the people. But in Germany, everybody's believing in doctors as gods. And when the doctors say you have a diagnosis and the only option is medication, then they believe it and then they do it. And then they don't try other things. So I don't know how to get information like this out to other people.
Well, this is recorded, so maybe you just did it.
Yeah.
People,
There
yeah.
you go. You can share that. I'll post it in the group, but I do have to run. I got to get to a mentorship call, do some teaching. But thanks everybody. Thanks for showing up. This was a great conversation.
Yes.
We got a lot of value out of it, and yeah, I'll see you around the bend. Okay.
Yay.
All right.
Congratulations, Kirsten.
Thanks.